to the Ask Me Anything series on COVID-19. I'm here with Professor Karen Kier, Dr. Karen Kier. She has a PhD in epidemiology. She teaches at Ohio Northern University. And Dr. Kier, I have a pair of questions here. One of our writers, question askers says, I have heard often from an anti-mask friend that the dangers of mask wearing, such as bacterial overgrowth in homemade masks, is problematic. Also, this individual questions the effectiveness of homemade masks in general and believes there is no credible documentation of asymptomatic transmission.
Well, that's a bundle of questions right there, but those are good questions to ask. So actually there is data to show that the face masks and the cloth ones can be effective. So the point of those masks is really covering the nose, under the chin, making sure that there's no gapping where air can get into the nose or to the mouth. So really it's all about protecting the respiratory tract, whether the nose or the mouth, either one, from droplets getting in. So the cloth masks are effective. But the thing about the cloth mask is that it's like any other thing. You don't wear the same clothes every single day. You wash your clothes, you wash your underwear, you wash those things. So yes, you have to wash the mask. That's the best thing that you can do, is to keep that mask clean. So you should have multiple masks such that you change those out, and especially if you're kind of out and about or around other people, I would be changing that mask out as well. And some of the disposable masks are fine as long as you're getting a tight fit with those. I've seen a lot of those sometimes where they're gapping a lot for people and they're not really kind of pleating them and fanning them out and making sure they're covering and that they're tightly around the nose and under the chin. So it's all about how you're wearing it. And so, that's an important thing. So there is evidence that those homemade masks do work. And one of the ways, how do we know this? Well, when they first started and we couldn't get the personal protective, a lot of people were making the homemade masks and sending them to healthcare workers. And a study just came out literally last week that looked at those protective equipment in healthcare, saving nurses' lives, saving doctors' lives, saving respiratory therapists' lives. And it did show those masks were really very effective. They had to keep them clean and they did change them out. But we know that we saved healthcare workers' lives because people made masks and sent them in. So you're far better being protected, but it's important in terms of how you wear it and how you clean it and keep them clean. So Chris, what was the other part of that question besides just the effectiveness?
The question she also said that her friend also believes there's no credible documentation of asymptomatic transmission.
There is actually very good evidence of asymptomatic transmission. So when you look at the current CDC guidelines, as well as several studies from the New England Journal of Medicine, they actually have documented in studies asymptomatic. So we now know taking a fever is too late. If you have a fever, it's too late. You have actually transmitted the potential. If you're positive, so the bottom line to that is, what a great question. So the bottom line to that is, if you have tested positive and you have the virus is in your respiratory droplets, and anything that you can sneeze, cough, whatever, those droplets are out there and someone else can get it. It can be transmitted. We have people who have COVID-19 that never have a fever, never have any symptoms, but they're still positive. They have a mild form of the disease. They are contagious. And they're excellent documentation published in medical peer-reviewed journals that shows that asymptomatic, yes, absolutely. If you have the virus, you can transmit the virus. Doesn't matter if you are severely ill on a respirator or you're asymptomatic out in the community.
Okay, thank you very much.